Well, here we go. We're taking a look at HealthCare.gov, and a lot of talk about this website, and a lot of folks really haven't been to it or checked it out, and I thought you might be interested. This is the main page that you get when you first click in. It says you can apply online or you can apply by phone. Of course, you can't apply by phone or apply online because neither of the systems work yet. It is November 8th, and we're going to try it this morning. You can scroll down and you talk about seeing plans and prices in your area. In many cases, most of these links don't work. They do have this ominous 143 days left to enroll, and they remind you that you've had since October 1st for open enrollment. Coverage can begin January 1st, and if you haven't connected by March 31st, it is too late according to this website. So we are going to go back to the top of the site and we're going to log in. And I've already entered all of my personal information, my login information, my income and financial information. So we don't need to go begin that. That is an arduous process, in particular today. I've already done it. Now, you can see I've got these little bumps here. You have a notice available about your marketplace eligibility. There's no way to find out what that notice, which they tell you is available, no way to find out how to get to it. You can click all over the place. Doesn't do anything there. There are 5 of them. It seems important enough to them to provide them, but it's a teaser. They just won't let you get there. Now, the only thing that does light up with the little hand with the nice finger there is this X. Now, in the old days, X's would delete it, and let's see what happens. Oops, it's deleted. Oops, deleted. And they're now all gone. Well, that's okay. These pop up, and they'll come right back next time I get bumped out. But it does show that it's got my name here, James. That's kind of nice. And it shows that I do have a current application. It says that my status is in progress, which means that they do have some memory of me visiting before. And since I have been here before, I know that if I take the cursor and put it over this area, it says it's the 2014 Michigan application for individual and family coverage. That's me. I'm going to click it and see what happens. Now, it's the middle of the night. It is 4 in the morning. And I did this on purpose. Not too many people on the East Coast will be up at 4 in the morning to clog up the website, like some Democrats have suggested that Republicans like myself are somehow being able to stop the site by virtue of getting online often. I figured I'd give it a break and do it at 4 in the morning. And of course, that's 1 o'clock in the morning, California time. I don't think a lot of Californians are up at 1 trying to get into the website. It's 2 o'clock in the morning in Denver, and it's 3 o'clock in the morning in Chicago. So hopefully this will be kind of a slow time. Now, this is kind of good. It does show up here that it's the 2014 application. It says the enrollment is incomplete, but bingo, it says resume enrollment. That's exactly what I'd like to do, so we'll click on that. Oh, and it's very zippy. And this is the good sign. You can see that it says I'm not enrolled yet. Review your application details in your marketplace account to resolve any outstanding issues with your application. Oh, I'm sorry, that was a period. Issues with your application must be resolved to keep your coverage. Well, rather than go down here, I'll hit this. See, because it's in red, it's got that little exclamation point. Doesn't seem to want to allow me to review my application details in my marketplace account. But that's all right, because it does have a friendly little check right next to the set premium tax credit usage, which I've already been through, and I don't need to change it. And it's got a nice little friendly check around the answer questions about your household, and so I don't need to change that. Down below, it's got some reference to a dental plan and review and confirm your coverage. Both of those are locked, so it doesn't appear I'm going to go there. But here it says select a health insurance plan, and that's where I want to go. It's kind of interesting, though. If you go here, you see the little little hand with the pointer. Go over here, you see the little, like an eye bar, so it's pretty clear that the people hired to design this portion of the site are different from the people who designed this portion of the site. And they use a term that's not really common in computers, where it says set. I'm assuming they mean click or sign in or what have you, but set is the word they use. It's got the little eye bar, we'll click on it. And oh good, it's moving along really nicely at 4 in the morning, Eastern Standard Time. And we're waiting. Oh good, this is very zippy this morning. This is boilerplate. Seen this before. 3 things to know about the marketplace health plans. They must offer doctor visits, prescriptions, hospitalization, maternity and newborn care, and preventative care. It's essentially just a boilerplate there. We'll click to next. 3 more things you want to know, and then they've got the 4 categories, more boilerplate. Click next. And a little more boilerplate there, and we are going to click next again. And now we are at the beef. This allows you to select what they call plan categories: the bronze, the silver, the gold, and the platinum. And they have some information, not really a lot. I think it makes a lot more sense to go up to the top and hit show all. In other words, take a peek at all of the plans that are available. And in Michigan, there are 31 plans at least available to me. A 64-year-old single old geezer guy. Now this is also good news. You can see up here it says your selected plan, and there's a nice little comfortable check mark next to it. I did earlier go fill out my information, look at this Blue Care Network, what they call the Blue Cross Partnered Silver. Now I don't really know what that is. I've been to you can see there's an HMO and there's a silver, and then there's a cost sharing reduction plan point. Clicked on those in the past. They haven't worked. Nope, don't work today. They've never worked. So I don't really know what the difference between the HMO is, the silver, or what this cost sharing reduction plan is. But it does show that I've saved it. It does show it's my selected plan. I'm not going to go down to the other 30. You can do that on your own if you get this far. But this is where I want to be. I want to enroll in this plan. You can see that it's a $1,450 deductible. It says group total. Don't quite understand what that means. Over here it says out-of-pocket maximum. Now they don't let me know, is that an out-of-pocket maximum of $4,500 per year, per month, per day, for the life of the policy? They're not clear on that. They do have some co-payment information over here. None of this is as good, by the way, as the policy that I currently have. I currently pay about $400 or $290 a month for a $1,000 deductible and a $2,500 out-of-pocket maximum. Now that policy that I currently have that is illegal according to the new law will expire and not be allowed to go forward after December 31st of this year. Now, as I said, I paid about $290 a month for that policy. This policy, if I didn't get the special subsidies, would be $469.50. So that's a pretty significant bump up from the $290 that I pay to almost $470 for a policy that's significantly worse than I currently have. But the good news is you can see this $16.50. I filled in my financial information, and the younger generations apparently are going to go to China, borrow a whole bunch of money, put it on their check, and they're going to give it to me in the form of subsidies so that my monthly premium will only be $16.50. So I ought to be happier with that. I'm really not. I think it's a disgusting, outrageous bill to put on young people's the future, but that's the law, as they say. Now you can click on this, which is one of the few buttons that does work here, and it shows kind of interesting things. $2,130 for managing type 2 diabetes. Typical yearly cost for managing type 2 diabetes for one person. I don't have diabetes. I don't know why I don't know if they're offering that to me because I don't have it, or if I would manage it, I would give it to someone else, or if that's the maximum. It's not very clear at all. But here's the one that I'm really excited about. $3,190 for healthy pregnancy and normal delivery. And again, typical cost for a healthy pregnancy and normal delivery. As a 64-year-old single man, you can tell that my enthusiasm for this part of the Affordable Health Care Act is really very high. But again, they're not very specific as to what the $3,190 covers. Is it maximum? Is it something I get for not having a child? Maybe a little bonus, which I'd be happy to accept. Or is it money that they send to you and then you can go spread around to those who you feel would be best able to help your pregnancy? It's very much unclear, but at this point I'm not as concerned as I am about this really nifty little button which says enroll, because this, I'm assuming, because it does say enroll, will allow me to click and get my $16.50 a month Blue Care Network of Michigan healthcare. So let's do it. I wish we had a little drum roll. I'm not that sophisticated. Oh, well, something's happening here. Oh, my golly. Well, we've been here before. It says review your application details. They won't let you do that. Set the premium tax credit. Been there. Been there. Been here. Back to the little somewhat confusing term set. We'll click it, give it another chance. And okay, we're back to where we've been. So this is the circle that we go to. I am stopped from enrolling, taking my wonderful gift from the youth generation, or the younger generations. And here we are. It is now 4:19 in the morning. And down here you can see live chat. I could enter into that. I've done that before. Very nice folks on the chat area. But essentially all they say is, hey, our computer doesn't work either. Get off my back. So with that, we'll say USA.gov down there. Apparently they're nice, comfortable, maybe perhaps even asleep. Hopefully some of them are awake working on this website. HealthCare.gov. If you haven't been to the website, you can save yourself the time. Just take a peek at the at my little video, and you will know what it's like to be just so close, and yet the cigar is only available to President Clinton and not you or me. Bye-bye.